Bonnie is the CEO of the Daisy Foundation, I think CEO with her husband. So just to tell you a little bit about Bonnie, we're going to California, I think, before 6 a.m. And Bonnie and her husband, Mark, were retired and growing wine grapes in California when Mark's son, Patrick, became very ill. And as a result of their experience with his nurses, Bonnie and Mark, have dedicated the last 21 years to expressing their gratitude to nurses for their extraordinary compassionate care. I'm sure Bonnie will tell you more of their story, why they're so passionate about nursing, and what the Daisy Foundation does to honour our profession internationally. And Bonnie is joined by Melissa Barnes, and Melissa is the Vice President of Operations and International Director. So I give you a warm welcome, Bonnie and Melissa.
Excellent. Thank you so much. Well, after that very weighty conversation from Howard, we are here, Melissa and I, to talk to you about something that we hope will be quite a lift. And that is the importance and opportunity to express gratitude for nurses for the extraordinary compassionate care you all provide each and every day, and for what nurses and midwives at the bedside and the chair side are doing for patients and families. So this presentation is all about the Daisy Award for Extraordinary Nurses, and we're thrilled to be here to talk to you all at INMO. I want you to meet my family. This is my son, Patrick. He was 33 years old at the end of 1999 when he contracted the autoimmune disease ITP. He had just given birth to our first grandchild, or actually his wife had just given birth to our first grandchild. And when he got sick, my husband and I went to Texas, where he and his family lived, thinking he would be in the hospital for just a couple of days. Well, tragically, that's not what happened. Pat became increasingly ill, and over the course of the following 8 weeks, we got to see nurses at their very best. And when Patrick died, it was very clear that for us to hold on to something positive in the world, we had to focus some attention on the extraordinary care of nurses. It was nurses who got us through those 8 worst weeks of our lives, and we needed to say thank you. Simple as that. So right after he died, we got together as a family and created the Daisy Foundation. Daisy actually stands for Diseases Attacking the Immune System. And it was our way of naming it to keep us rooted in our experience with Pat's illness, but also something that could have a picture of beauty that would replace the true ugliness of what he had gone through. Well, what is the Daisy Award? This is the program that we created as our way of saying thank you to nurses. And it has become the International Nurse and Midwife Recognition Program that's based on what is really meaningful. And that's those stories of patient and family care and gratitude for what nurses do every day, all around compassion. We know that nurses provide and midwives provide extraordinary clinical excellence. What this program really focuses on is what we did not expect as a family, and that is the sensitivity and kindness and compassion and warmth that we experienced from Pat's nurses. So that's what the Daisy Award truly focuses on. It's recognition that is meant to last all year long. We were well aware of the US's Nurses Week and International Nurses Day, but that is just not enough recognition for nurses. And our intent is to make recognition a real habit within every healthcare organization we partner with. Our program is run by hospitals and organizations that adopt it. And it's run with our now 21 years of guidance and expertise. And we provide all kinds of materials and support to ensure that it is wildly successful for nurses and their organizations. Importantly, Daisy Award recipients are chosen by a committee in the organization, not by us at Daisy. And these honorees are chosen based on guidelines and criteria that are based on compassionate care and adapted to each organization's mission and values and way of talking about nursing excellence. So this program has got tremendous cultural flexibility built into it. We never imagined when we started out 21 years ago that the Daisy Award today would be honoring extraordinary nurses internationally in more than 4,500 healthcare facilities and schools of nursing across the continuum of care. I wish I could tell you we had some grand vision, a great business plan. That's not the case. We were a grieving family that had a drive and a compelling need to say thank you to nurses. More than 144,000 nurses have been honored so far, but most important to us is the fact that more than 1.8 million times a patient, a family member, or a coworker has written a Daisy nomination to share their story of how a nurse has impacted them and to state their gratitude. So clearly we are not the only folks who need to say thank you to nurses and midwives. One of the reasons I think for the program's tremendous growth has been the support of numerous nursing and healthcare organizations around the world, including, we are very proud to say, INMO and certainly ICN as well, as you can see from this chart of beautiful logos that lend their marketing and awareness building expertise to our work at the Daisy Foundation. We started the Daisy Award to say thank you to direct care nurses and midwives, but over the years, this program has evolved and we now have a means of honoring nurse-led teams in recognition of the fact that often it's more than one person who's doing extraordinary work for a patient or family. We honor nurse leaders because it's they who create the environment where extraordinary compassion can thrive. We have a brand new program for nurses who are working to advance health equity and support some of those goals that Howard spoke about a moment ago. We honor nursing faculty in schools of nursing for the inspiration they provide, for the role modeling they do that enables nurses to understand what it truly means to be a nurse. And we honor nursing students for the work they are doing when they're in their training and taking care of patients and families, as well as a Lifetime Achievement Award for those nurses and midwives who've dedicated decades of their lives to extraordinary patient care and leadership. So the Daisy Award has taken on a whole new life, and our goal is to honor nurses wherever you practice, wherever you are in your career, all based on the impact that nurses are providing. And speaking of impact, I could spend an hour talking about the growing body of evidence and research that reveals what meaningful recognition and the Daisy Award are accomplishing globally. But we divide this into three areas: healthy work environment, nurse engagement, and the patient and family experience. And as you can see at the bottom of this slide, there's a page on our website that addresses all of this. And I'm very happy to talk about the impact, but just to go through this very briefly, in terms of a healthy work environment, we know that in celebrating all the right that's going on in healthcare, this is providing a reminder of the why of nursing, why nurses become nurses. That reminder is something that roots them in making sure they're doing the best job possible. And meaningful recognition is one of the 6 standards of a healthy work environment. In terms of nurse engagement, by promoting extraordinary compassionate care and providing it, we are seeing improvements in nurse satisfaction and retention, and even resilience, which is of course so critically important during these unbelievably stressful times for nurses and midwives. And in the area of the patient and family experience, our research shows how the Daisy Award is reinforcing the concept of patient and family-centered care, and even generating a sense of community loyalty to healthcare systems based on the ability for patients and families to express their gratitude in a structured way. So speaking of structure, I want to turn this over to Melissa Barnes, our Vice President for Operations and International Program Director, to share with you much more about how the program works.
We have a team of consultants that work one-on-one with each facility, helping you build the habit of recognition for your licensed, registered, advanced practice nurses and midwives all year long. This includes recognizing those who are nominated. Bonnie. Next slide. Thank you. In this day and age, if somebody took the time to write a nomination, we believe that that is also worthy of recognition and that the nurse should have that thank you written to that person. And so we ask that you give not only the nomination, but a thank you card that can be signed by your nurse manager, a great way for them to have a positive interaction, or the chief nursing officer, along with a special nominee pin. This is a wonderful way to really spread the recognition throughout your entire facility, celebrating all of the right that happens every day. And you have a wonderful way to celebrate those nurses who just received nomination after nomination. Next slide. Part of the program is that, as Bonnie said earlier, you choose your own honoree against your criteria, and then you have the presentation right there in the unit with your nurse or midwives peers. The chief nursing officer always is the one who presents the DAISY Award, a certificate signed by Mark Barnes, Pat's dad, along with the chief nursing officer, that reads, "In deep appreciation of all you do, who you are, and the incredibly meaningful difference you make in the lives of so many." And it's housed in this beautiful portfolio. The nurse or midwife will also receive their own special DAISY Award pin, celebrating that long relationship between nurses and pins. And they receive this beautiful sculpture. This is a very ancient African design that Mark and Bonnie dubbed a healer's touch to represent nurse and patient. I'm very proud to say that we ethically import these sculptures from 21 artists from the Shona tribe in Zimbabwe, a country with great political strife and unemployment. And because we place our orders with these specific artists, they in turn are able to support their entire community of over 300 people just with the work that they do for DAISY. You can go on our website and see how they create these sculptures out of serpentine stone. They made with extreme pride and signed by the artists, so no two are alike. And yes, we ask that you provide cinnamon rolls or some kind of cinnamon treat with every celebration. When Patrick was ill, no matter what my family tried to tempt him with, he just did not want to eat anything. Well, one day his father came in with a big cinnamon roll for his own breakfast. Pat took one smell of that cinnamon roll, asked his dad for a bite, and of course ate the entire cinnamon roll that day. Later that night, when they were getting ready to leave, he asked his dad, "Will you please bring me another cinnamon roll? And please bring enough for my nurses," which they did. The next day, they brought in a big box. Legend has it they were gone in seconds, so we're very comfortable believing that nurses and midwives also like cinnamon rolls. But truly, it is a tradition to have a special treat during a celebration. And in Patrick's memory, we would like it to be what he offered to his own nurses. We also have a special message that we ask that you repeat at every celebration. Too many times nurses say, "I didn't do anything special. I was just doing my job." And it's so important to remind nurses that when patients are scared and vulnerable, it is to you, their nurse, that they turn to. So please do not take what you do for granted. We know firsthand that patients and families do not. And we ask that you let the wonderful cinnamon aroma be a sensory trigger. So wherever you are and you smell cinnamon, that you stop. Think about that positive difference you make in the lives of so many. And remember how special you are because you chose to be a nurse. Truly worth celebrating. Next slide, please. We also provide international recognition for your DAISY honoree by asking for the picture and the nomination story. We then create what we call a spotlight that lives on our website that your nurse can then share with their friends, their family, post it to their own social media. And your hospital can use this as a wonderful way to celebrate all of the right that happens in the hospitals. Next slide, please. You receive a one-time Congratulate Our DAISY Award Honoree banner. It's a 6-foot vinyl banner that goes from unit to unit as you give out the DAISY Award. We also provide you with all of the templates, ideas that you need to get started to be successful with your DAISY Award program. Next slide. The costs of the DAISY Award Our recommendation of the number of presentations you have per year is based on the number of nurses, roughly 2% of the nurses. This includes complete award package, everything I just mentioned, along with the nominee pins and the one-time banner, as well as a welcome kit to help you get started, and of course, all of our consulting fees. Next slide. If you are interested in learning more about the DAISY Award, please feel free to contact me directly. I would be happy to have a conversation with you of how meaningful recognition can work in your own hospital. We'd like to open it up to questions, and Bonnie, if you'd like to come back on.
I'm coming. Can you hear me? I know, there we go. Good morning. Can you hear me?
Yes.
Yes, we can.
Well, certainly welcome to take any questions. Fiona, if any are coming up.
Haven't got any at the moment. I just give one look here too. I don't have any questions so far, Bonnie. Just wanted to say sorry. I wanted to acknowledge the loss of Patrick. Thanks for sharing your story, and especially the cinnamon, and to recognise the great work you've done for nurses for the last 21 years.
Well, thank you, Fiona. And I can't tell you how much we would like to see this program grow to more nurses and midwives in Ireland. And we so appreciate INMO's support in making that happen.
Lovely. Thank you so much, and have a great day.
Thank you so much. Bye, everybody.